Hello, my name is Mary, and I chose to do my final presentation on case study number 2, the young working adult whose age bracket puts him into the millennial generation. I chose to focus this assessment on anxiety. He is a 28-year-old male, 1 week post travel with sinus congestion, runny nose, clear mucus, cough, recently diagnosed with a sinus infection at clinic. He has been um, occasional anxiety related to stress in the past, which has been treated with melatonin for trouble sleeping. He's currently in graduate school and experiencing COVID related stress due to career and job pressures. He's traveling round trip to the University of Virginia. He has recently been around a lot of cases, confirmed COVID cases present at the university. He has no fever, cough, fatigue, shortness of breath, foul taste, chest pain, palpitations, orthopnea, nocturnal dyspnea, or edema. He's currently taking doxycycline 100 milligrams by mouth twice a day for 10 days, hydralazine 50 milligrams by mouth twice a day for anxiety, melatonin zero point 0.3 milligrams as needed for sleep. The hydralazine is a medication error. Hydralazine is an antihypertensive, so I will talk more about that later on in a future slide. Vitals are normal. Heart rate is 60 to 100 beats per minute. Blood pressure is 90 over 60 to 120 over 80, 12 to 18 breaths per minute, 100% oxygen saturation, 98.6 temperature. Eyes are perla. Pupils are equal reactive to light. Body systems, respiratory, lungs are clear on auscultation and percussion. Ears are clear without redness, tenderness, swelling, or pain. Nose is runny with sinus congestion and clear mucus in the throat. Skin is warm and dry. Lips and nails are pink. Capillary refill is less than 2 seconds. Peripheral pulses are strong with no jugular vein distension that's noted, no bruit or adventitious sounds noted on auscultation. Regular bowel movements, no pain or tenderness. Bowel sounds noted in all 4 quadrants. No loss of appetite. Urine is clear, yellow, and even stream. Oriented to person, place, and time. Normal gait when walking. Maintains balance when touching finger to the tip of the nose while his eyes are closed. Reflexes are intact. Glasgow score is 15 and speech is clear. Strong and equal grips on bilateral sides of both arms, hands, legs, and feet. No weakness noted with full range of motion. No problems or issues noted in reproductive area. No pain, lumps, or swelling. Lymph nodes are not swollen. Diagnosis is generalized anxiety and sinus infection. I'm going to be focusing on anxiety. Differential diagnosis for anxiety is pheochromocytoma, asthma, AFib, hypothyroidism, alcoholism, delirium, diabetic ketoacidosis, and substance abuse. I'm going to go into why all of those are possible for anxiety. Anxiety is linked to fear. It manifests as a neurophysiological response and 4 different areas: cognitive, affective, physiological, and behavioral responses. These all come in response to a perceived perceptions of both real or imagined. Pathological anxiety happens with an overestimation of a threat or danger. It's one of the most common psychiatric disorders because many times people do not seek treatment, and a lot of times it goes undiagnosed. Specific phobias and social anxiety are the most common of the anxiety disorders. Anxiety is mediated by both the autonomic nervous system, sympathetic, and central nervous system through norepinephrine, serotonin, dopamine, and gamma aminobutyric acid, also known as GABA. The amygdala and limbic system are connected to the prefrontal cortex of the brain. The amygdala helps to rein in fear. The structure is increased in those with anxiety, which can be reversed with both pharmacological treatments and psychological interventions. Anxiety, cognitively, people fear losing control, death, going crazy, mental images, memory, confusion, difficulty speaking, concentration, negative perceptions by others. Some of the physiological responses are an increased heart rate, rapid breathing, chest pain, sweating, chills, shaking, weakness, upset stomach, or dry mouth. Some of the behavioral manifestations are restlessness, agitation, pacing, freezing, difficulty speaking, and escape. Affect is nervous, tense, fearful, jumpy, impatient, and frustrated. This is the pathophysiology flowchart for anxiety. Some of the pharmacological things that you can use are selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, benzodiazepines, tricyclic antidepressants, mild tranquilizers, and even beta blockers. Non pharmacological treatments, psychotherapy, we can use cognitive behavioral therapy, which is structured and goal oriented, didactic therapy, which helps to identify and modify thinking patterns and beliefs, and then to help change them once you're aware of them. Exposure therapy is for facing fears, people that have phobias. Health promotion, it's a diverse and multifaceted disease, as I've already mentioned. It takes a multidisciplinary team of mental health nurses, psychiatrists, psychotherapists, social workers, primary care providers, and the family needs to be involved. Family members for discharge planning should be involved as much as possible to learn how to identify symptoms and help manage the condition. Look out for warning signs and red flags. Patient must be committed to therapy and seek out help when they have symptoms that arise. We're going to be consulting with pharmacy and the primary care provider to discontinue the hydralazine, maybe find a different substitute, or just continue with the melatonin. I also have some alternative and complementary things to use. I have them going under the non pharmacological and health promotion because they're both intertwined in that as well. You can use exercise, yoga, meditation, and mindfulness are all complementary therapies that can be used to combat anxiety. Going outside for a walk to reset the mind can be a form of exercise. Acupuncture has also been found to be effective. There are a lot of other things that can be used as well as far as different therapies. You just have to find something that works for each person. There's aromatherapy, cold showers to just kind of help reset the mind. There's a lot of different things that can be done. You just have to find what works for you. These are my references right here, and thank you so much.